Alcohol and drug use are highly stigmatized issues, and routine screening and brief intervention in primary care sends a strong message that these are important aspects of health and wellness. When the healthcare team introduces the topic of alcohol or drugs, it opens the door to discussion and means that the patient does not have to bring up the topics on their own. We know that substance use disorders are preventable, and just like as with other chronic health conditions like cancer, cardiovascular disease, or diabetes, earlier intervention improves health outcomes and quality of life. Here are a number of examples where early intervention to address alcohol and drugs is particularly important in primary care settings. Since alcohol and other drug use often begins during adolescence, it's important to implement routine screening by at least age 12. Young adults are at particularly high risk for binge drinking and for engaging in other risky behaviors associated with alcohol and drug use. In women of childbearing age, binge drinking and other drug use increases a woman's risk for not using contraception effectively and her risk of sexually transmitted infections. 50% of pregnancies in the United States are unplanned. Routine screening and brief intervention for alcohol can help prevent fetal alcohol spectrum disorders, which are the most common preventable birth defect. Older adults are at increased risk for falls, medication interactions, and chronic disease exacerbation associated with alcohol. Alcohol use should be considered a contributing factor in anyone experiencing sleep problems. Routine screening for alcohol use can help to identify patients at higher risk for opioid misuse as part of good pain management. Tobacco and unhealthy alcohol use commonly co-occur, and it may improve outcomes on both issues to address them together. Drinking above a moderate level is a risk factor for new onset depression, a risk factor for suicidal ideation and suicide attempts, and because alcohol is a depressant, it can worsen depression and other common mental health conditions.